So today I figured I'd come out here and I would tell y'all about my journey with multiple sclerosis. So a lot of people always ask me, well, how did you know you had MS? How did you know? And when I tell you it was a series of unfortunate events that led me to find out, baby, it was a series of unfortunate events. So let's go back to 2021. So 2021, long story short, I end up in ICU because I found out I had these huge blood clots all over both my lungs. When I tell y'all, oh Lord, I got crumbs on myself. Don't mind me. Um, like, okay, I was saying I ended up in ICU. I had found out I had blood clots all over my lungs. I went to ICU. How I ended up in ICU was like I had not been feeling good that whole week, and like I felt like somebody was strangling me, like trying to suffocate me and like grasping my neck. I couldn't breathe. And so by that Friday, I was like, okay, you need to go to the ER. I was like, because what if it's not pneumonia? I was like, or what if it's a worst case of pneumonia? Because I feel like almost every year I get pneumonia. So I get to the ER, I could barely breathe. And they do all the like triage, and then they like, they come back out and give me, they're like, we want to do a CT scan of your chest because your heart labs are like abnormal. So I'm like, okay. I go get the CT scan, come back from the CT scan, sit there. Basically, long story short, they like, girl, you dying. You got these huge blood clots all over your lungs. We're going to try to save you. We're going to give you some medicine. You can't move. You can't do nothing. So the medicine that they gave me for the blood clots, one of the side effects was you could have an aneurysm, a brain bleed, and like they were like, tell us if you have a headache. So of course I keep having a headache, and I'm like, oh Lord, I must got an aneurysm too, or I got bleeding on my brain. They do a CT scan. They come back to my room. They're like, oh, you don't have an aneurysm. You don't have any bleeding on your brain. You're fine. I check out when I'm getting ready to like check out of the hospital. That when they finally about to let me go home. And I'm reading the paperwork, and I just kind of glimpse over it. When I finally get home, get showered, get something to eat, I read the like paperwork about all the imaging that they took while I was in ICU. And it said on the CT scan for my brain that I had lesions. And I was like, listen, I ain't no doctor, and I know I'm not the brightest Crayola in the Crayola box. But I was like, I don't think you're supposed to have lesions on your brain. So I had to go to a visit with my PCP after I got out of ICU, because she basically took over my care because I was on like 10 medications when I got out of ICU. And she was like, okay, I'm going to order an MRI. So I do the MRI. A week later, I found out, a week after I got out of ICU, that I had MS. I get in with a specialist. Shout out to my specialist. To me, I feel like he's the best. He listened to me. He don't, discredit what I'm saying. He take everything I say seriously. He fill out all my disability, MF, FMLA, whatever you want to call it. Any kind of paperwork I need him to fill out saying what I have, he fill it out, no questions asked. He always tell me what to expect. He's like the best. And I'm going to have more videos where I tell y'all about why I feel like he's the best. So when I go and I meet him, he tells me like a whole bunch of different symptoms that people with MS can have. And so he naming off all these symptoms, and in my mind I'm doing like a little checklist, like, yeah, I got that, I done did that. And I'm like, I've been doing that since about I'm gonna say 08, 09. So I really feel like I've had MS since probably like 08, because in 08 I had some issues with my vision. I went to the eye doctor, the optometrist, and they were like, oh, you have like some swelling in your eyes, and it's kind of like hypertension that they can see that's going on in your brain that you can they can see in your eyes. And like when I would lay down at night, I would hear this like swooshing sound. It sounded like to me like the dishwasher was always on. Y'all know how the dishwasher be like shh, shh, shh. Y'all know what the dishwasher sound like. It sounded like when I would lay down, it sounded like the dishwasher was on. So I was like, I done had that since about '08. And then one of my other symptoms, it's not as bad as it used to be, but I would like randomly drool. Y'all don't judge me. I'm telling y'all my story. I'm trying to help somebody else so that they don't feel like they're alone out here in this world. And like sometimes I do this a lot, or I might, like swallow, or sometimes if I swallow, I might choke a little bit because I'm like, ooh, I done had a lot of saliva building up in my mouth. So I feel like I'm a little bit more aware, and now that I know what it could be, I'm like, okay, let me, make sure I'm swallowing so it doesn't build up. And then, so some of my main symptoms that I feel like I have right now that like bother me the most is, number one, I always get overheated. Y'all will see, I have a video on here telling y'all where y'all could literally see sweat trickling down my face, and it's like nighttime. I sweat a lot. I get overheated easily. I always have like really bad headaches. I have like, I call them ticks or tremors, like where my hands are randomly like, I feel like, why are you? And then sometimes I feel it like in my legs and my feet. Sometimes I might get like where my hands might want to cramp up, my feet cramp up. The dexterity in my hands is not the best. Like in 2018, when I was in grad school, like I remember trying to like cook myself some dinner, and I was like gripping a potato trying to slice it, and I couldn't even grip the potato. And I was like, oh, Lord, what is wrong with me? Why can't I grip this potato? Like I've been cooking my whole life. And so when I met my neurologist, he was like, yeah, dexterity in your hands can be an issue. Sometimes I have days where I just be randomly dropping stuff, or I might feel like I'm about to fall and trip. Like I don't feel like steady when I walk. I be kind of like insecure, like, Lord, please don't let me fall. So if you see me in person and I'm walking like a baby deer, judge your mama, don't judge me. Like I be trying to make sure I don't fall, because baby, I'm a big girl, who gonna pick me up? So yeah, so right now I feel like my main symptoms are the headaches, I get overheated, the dexterity, and just like not trusting my steps. So yeah. Oh, and I'm always tired. I'm always exhausted. So if you hear me say, oh, I'm exhausted. Oh, I'm exhausted. I'm so tired. I'm so tired. That's my forever mood. That's my forever state. Like, baby, don't don't feel like you hurting my feelings if you cancel plans. Don't feel you're not hurting my feelings, because baby, what I'm gonna do is I'm gonna get in this good bed and I'm gonna lay down, because baby, tired is my forever mood. Okay, y'all. It's a good Sunday. It's after church. So I'm in my favorite spot, the bed. So let's talk about when I met my neurologist, who I feel like is super bomb. He's just so bomb. Like I feel like he ate and left no crumbs. He left no stone unturned, in my opinion. So he was like, yeah, there, people who are not doing as well as you. He was like, yeah, what your PCP told you is true. You could wake up one morning and be blind out of one eye or both eyes, or can't walk and can't do this, can't do that. Well, he told me, he was like, okay, to slow down the progression of your symptoms, he was like, these are a few of your options as far as medicine. He told me, like, I'm like, okay, well, I have never had kids. I've never been pregnant. I want to be pregnant. I want to have a baby. I want to get married and have a baby. He was like, well, when you get pregnant, you just come up here, or, we can have an appointment. He was like, or you can call up here and let me know, and I'll let you know, like, what, course of action you need to take since you are with child. And I was like, okay, bet. So basically, he ran down my options as far as like medication. One of them being Orcavis is the one that I chose. The other one, I feel like it starts with a K. It's like Kemsumpta or something like that. I don't know if that's the one that's kind of like a chemotherapy drug, but one of them is like a chemotherapy drug. And I was like, I'm kind of vain. I'm not trying to lose my hair. I've been growing my hair out for the past 2 years. I done came a long way. So I'm like, I'm gonna go with the Orcavis. And he was like, okay. He was like, that's what most of my patients are on. And then once he told me about the Orcavis, he told me everything he recommended that I stop doing. He was like, I would recommend you stop eating meat. He said because meat has a lot of carcinogens in it that can give you breast cancer. And he said because of Orcavis, especially women of color, he was like, y'all are at higher risk for breast cancer as a side effect with Orcavis. And I was like, you know what? I could respect that. I could respect that you telling me everything. And like when I met my new gynecologist like a few months ago, she was like, I never knew that about Orcavis. She was like, thanks for telling me that. I feel like he told me like a lot of symptoms, a lot of side effects. I feel like he listened to me. And I feel like as a black woman, especially being, you know, I'm a big girl, I'm a BBW, whatever you want to call me, fat, overweight, obese. I know who I am and I know how I feel about me. I feel like a lot of people kind of discredit things that black women, especially bigger black women, are saying as far as their health. So for me, what I appreciated about my doctor was like he listened to me first. He listened to my story, how I ended up finding out that I had MS. He listened to like all of my symptoms, or like if he would name a symptom and I could kind of relate to that symptom, like I would tell him a story. And it's crazy because like doctors, they don't really get to spend a lot of time with you as a patient, and they're not supposed to spend a lot of time with you as a patient because that takes away from the next person. It takes away, it's all a money grab. It's all a money thing. Like, and I get it. I worked in community health before, so I get it. It's a numbers thing. It's a money thing. But I feel like even in that short span of time, like when we were just kind of going over symptoms and everything, like he heard me out and he didn't just like attribute everything to, oh, you're overweight. Like I've had so many doctors do that to me, and it just leaves a bad taste in my mouth. And so what my doctor ended up telling me was, he was like, it kind of like makes sense. He was like, if you are tired, you don't have energy, like you're already doing, told me you did a lot. I was in grad school. I got my master's. I became, a licensed counselor. I've started, some other business ventures. He was like, and then when it's time to, work out or anything, you're already tired. Like you're already exhausted. You've already did a lot. Like working is a lot for you. So if you try to throw in there a workout, he was like, it makes sense that maybe you will get tired and you don't go. And he was like, but I will say, I will encourage you to, lose weight, get the weight off. He's like, because that can also help with slowing your symptoms and your progression. So that is something that, I'm working on. I have a team of doctors. I have a dietitian that I'm working on to, make strides to lose weight, to potentially slow the progression of my multiple sclerosis.